This is a Moses tutorial part 2 presented by the SchrDbb with reference Atlas of Histology with Functional and Clinical Correlation by Dongmei Cui. So here we're going to visualize the cardiac muscles. As you have already seen the part 1 muscular tissue tutorial, so we are going to see, revise the fact that the cardiac muscles are branched, as you can visualize here, and then they are connected. One cardiac muscle, which is having only one central nucleus, is going to be connected with other multiple cardiac muscles by the intercalated disc. This is a disc here, and that disc is made up of multiple cap junction in order to transmit electric impulses from one cardiac muscle to another. And now we need to visualize the electric. You need to know that what the electron conduction system of the heart starts from the sinoatrial node, then it goes to the atrioventricular nodes through the atrial syncytium, then it goes to the bundle of His, then it goes to the right and left bundle branches, then it goes to the Purkinje fiber, which now goes to the ventricular syncytium. And when I say syncytium, it's just a connection of multiple muscular tissues. In this case, it's going to be connection of multiple cardiac muscular tissues. Now, this is the longitudinal section of, so this was just a schematic view. Now, this is the histology view with the longitudinal section of a cardiac muscles. So you can visualize, when you visualize here, it's much more quite different from skeletal muscles, which were just elongated and cylindrical. Here you see it is much more branched. So you can see one branch here. You can see branches here like that, and then you see central nuclei. Central nuclei, as you can see, you can visualize here. But you see it is much more branched. At this space, which is between two, which is a branch connection, you see one nuclei here, you see one nuclei here, which is connection between two muscular cells. This is small line here, so you can visualize some certain, if you are very keen, you visualize certain lines between two muscular cells. So this line here can be said to be an intercalated disc. You can see lines here, lines here, lines here, lines here. So if you are very keen, you see that those lines are, so there is intercalated discs on those lines, and there are certain striations. Now, the next thing to visualize on cardiac muscles, so this is now the transverse section, the cross section. So in the cross section, you just know this is also having the same configuration. We have the endomyosium, the perimyosium, and then the epimyosium. But in this case, for the cardiac muscle, it's going to still have the epimyosium, but after the epimyosium, we have the pericardium. You can still call this, if you don't want to call endomyosium, you can say endocardium, the pericardium, the pericardium. So the endocardium. The second one is going to be perimyosium, not the pericardium, because the pericardium is going to be after the epimyosium.
Now, so this is that. So we have fibroblast cells now located in the level of the connective tissues. Now, the next thing to visualize now is going to be the electron microscopic view of particle of the cardiac tissue. So for the electron microscopic view, you can visualize at one junction, as you can see here, these are Z lines. So this Z line shows striations. So let us go back on this image. You see that those lines, which are a bit dark like that, are going to be the lines which are going to show a particular sarcoma, with those striations being the Z lines. So it is having the same typical appearance with the skeletal muscles. So you have Z lines here, and those Z lines, you also have the I band and the dark band. So that I band is a light band, the dark band is the A band, just like the skeletal muscles. Then at the end of the I band, you have many mitochondria. So the mitochondria here are much more compared to the case where you had smaller mitochondria in skeletal muscle. That's why the heart, you are capable of heart pumping with the heart all through your life. So all through your life, your heart is just contracting. But for the skeletal muscles, you cannot contract one skeletal muscle for a very long period of time. It's going to be excessively fatigued. So that's why this mitochondria show now this particular peculiarity now for the heart muscles. For the heart muscles, the mitochondria are enormous compared to the skeletal muscle. That's why we are pumping with your heart for the whole life. Now the next one, this part here is going to be called this part here is a peculiarity also for for the skeletal muscles. Now you need to, for the cardiac muscle, you need to know that the skeletal muscle do not have junction between each of them. One skeletal muscle contract as a whole. Only one skeletal muscle contracting on itself. So now multiple skeletal muscles can contract together, but because they are controlled by a nerve. So multiple skeletal muscles can contract together only because they are controlled by a neuron. Is it clear? But now we need to know that for the cardiac muscles, they are not actually contracting together because they are controlled by a neuron, but instead because they are having a particular junction. And that connection, which is a junction, you have different parts involved with it. So that those junctions are going to be called the intercalated disc. So this is the peculiarity of a cardiac muscle. And also intercalated disc is made up of the adherent junction. We have already visualized the peculiarity of adherent junction in the tutorials you've done before. We have gap junctions also, which are multiple intercalated discs in order for increase the transmission between the one muscular tissue with the other. Now you also have here the transverse tubules. So these are the transverse tubules, and then the arrangement also in the transverse tubules, you can visualize here. This is the mitochondria, this is the mitochondria. Actually the arrangement is not actually that the same as with the triad that we had for the skeletal muscle. So you can visualize here at the end of the transverse tubule we have the mitochondria and mitochondrion. So we don't actually have the sarcoplasmic reticulum as you were seeing before. So this is the tutorial of this cardiac muscle. So this is just visualization of the cardiac muscles. So cardiac muscles, I'm sure we have the A band, the I band, the H band, which was the center. These are the light band inside the dark band. So that's the H band. I've said it, the Z line. I've already spoken about that. So so these were the different parts that we have visualized now on the cardiac muscle. Now the next one now is the smooth muscles. So for the smooth muscles, you need to know that what this is the schematic representation of smooth muscles, and then the smooth muscles are controlled by a particular autonomic nerve. The smooth muscles are also contracting as a situ, because one nerve is going to cause a contraction of one smooth muscle, then we have the transmission to the other smooth muscle as a situ. So that is why they have multiple gap junctions, as you can see here. Now this is the histologic section of a smooth muscle. So this histologic section has been taken on the duodenum. You need to know that what the duodenum or the bowels are made up of multiple layers. We have the mucosa, we have the submucosa, we have the muscularis, layer, and then we have the serosa. Now the muscularis layer is what is shown here. Now you need to know that what there are two main muscles located in the muscularis layer. You have the circular muscles and you have the longitudinal muscles. The circular muscles are mostly the sphincteric muscles for the contraction inside, so as the circular pattern, and then the longitudinal muscles are mostly the peristaltic muscle in order to push the material further forward. Now we can visualize here the circular muscle, the longitudinal muscle layer here. I have the circular muscle layer here. Between the circular muscle and the longitudinal muscle layer, we have the mesenteric plexus, and this plexus is involved with the rhythmic contraction of the skeletal of the small muscles located in the bowels. Then out here you have the alba plexus. Then lastly, so inside, this is inside. So then lastly outside we have the serosa. Sorry, this is the lumen and then the epithelium there.
So this is a visualization. So for the circular muscles, this section can be seen. For the longitudinal muscles, this section can be seen, and you can visualize here that these muscles are not quite, they are not even striated, so they have only one nucleus. This is the cross section. So it is circular at the center, circular, but here you see it is much more spindle. They have elongated nuclei. Their nuclei is elongated just like the fibroblast. They're spindle just like the fibroblast. So, and they don't have striations. Just that relative to the spiroblasts, they are much more having hematoxylin and eosin stain. They are much more eosinophilic, that is pink, or hematoxylin and eosin stain. So now this is the smooth muscle of the uterus. So the smooth muscle of the uterus can be seen here. So you need to know this is a diagrammatic representation with the magnification is quite small. That's why you cannot visualize, we cannot easily identify the structure. That's times 136. Now we need to know that what these smooth muscles of the uterus is very important because they are involved with the Ferguson reflex involved in the childhood. So the Ferguson reflex is just increase in the contractility of the uterus because of the passage of the fetus through the birth canal. As you just see, if you're Ferguson reflex, because the more the head compresses the cervix, the more the nerve receptors are going to be stimulated, and the more oxytocin is going to be produced inside the blood until the baby is going to be expelled from the uterus. Now the next one, we have the smooth muscle. So this is a smooth muscle of the bronchial. You need to know that the level of the bronchial, the first part here we have the epithelium, and this epithelium is pseudo-stratified striated epithelium located at the bronchial. Then we have the next one, which is here we have the smooth muscles. So the smooth muscles here are located at the level of the bronchioles, and then also have cartilages which are surrounding the bronchioles. So when you have smooth muscle in the bronchiole, you have chronic asthma. So chronic asthma can also be very important clinical correlation in case of smooth muscle of the bronchiole. So asthma is a chronic condition. It's a form of a chronic obstructive pulmonary disease because there is obstruction of the lungs. So the characteristics is wheezing, shortness of breath, chest tightness, and coughing. So that is it. So for chronic asthma. Now the peculiarity of chronic asthma now on a histologic section is what? We have thickening or hypertrophy and hyperplasia of the smooth muscles layer. So if you have thickening, hypertrophy, and hyperplasia of the smooth muscle layer, it can make you think of chronic asthma. The second thing, plus the clinical presentation. Second thing, we have airways blocked by cell debris. So you have the airway here, we have the mucus which is located, and we have cell debris in the airway. So all these triad make you think of exactly chronic asthma. So a triad of mucus plus cell debris in the airway plus hypertrophy and hyperplasia of smooth muscle layer. So now this is a electron microscopic view of the smooth muscles. So the smooth muscles you have here mitochondrion. So but you need to know that what in this case, when you see the electron microscopic view, you don't have the I band and then the dark band, which is the E band. You don't have that again. So in this case, you instead have the main filament which is involved here for contractions. You still have the actin and the myosin filament, but you see the dense bodies. So in this diagram there, in this box here, you have the actin filaments which are the smaller one. The myosin filaments are going to be the larger ones here. So you have this larger one which are in circle, this larger one which are in circle, like that, the myosin filaments, while the smaller ones are going to be the actin filament, and then we have the dense bodies. The mitochondria, we can see one large mitochondria in one muscle cell, and now we also see caveoli. So these are the certain caveoli, and those caveoli are just the protrusion, the cuppings of the cytoplasms in order to store calcium. So those are the caveoli. So these are the dense plaque. The dense plaque
which are usually involved with the formation of the macula densa. We have the intermediate filaments which are located there. So all that is involved with the small muscles. So you need to see that what the functional unit of small muscle is no more the sarcomere as in the case of skeletal muscle and the cardiac muscle. Here you instead have a small section where you have actin myosin filament, a dense bodies, the caveolae and the intermediate filament mitochondria which are involved. Here he said that the intermediate filament provide mechanical and structural integrity for many types of cells including the small muscle, so that the intermediate filament is mostly involved for structural integrity. Now, although contraction of the small muscle is produced by calcium-mediated interaction between the actin and myosin filament, similar to that of the cardiac and skeletal muscle, it is you need to know that there is a significant difference. Also, I've forgotten to tell you that what the method of arrangement of the actin and myosin filament in case of small muscle is not by the Z-line I band, but instead by a crisscross pattern. So here they are instead crisscrossing. So I'm just going to show you that later. So it's a crisscross pattern. So let's visualize now a greater magnification of these muscles. So this is a skeletal muscle of the tunica media of medium arteries. So you can visualize here, this is the tunica intima, which is made up of endothelial cells. Then we have the internal elastic membrane. So after that, we have the extracellular matrix here. So this is the particular muscle spindle now with the nucleus inside. So actually, you can visualize caveolae. Caveolae now are the end cuppings of the cell membrane. We have the dense plaque also located at the periphery, and then inside we have the dense body. So this is the schematic representation now of that. So you visualize here that you have the nucleus located here. Now we have the dense plaque located at this part in here. Now this is the sarcolemma. So this is a crisscross. You can visualize the crisscross here, cross between the different the cell membrane. So this is the spindle. As you can see, this is one spindle here, muscle spindle of the small muscle. Now this muscle spindle of the small muscle here at the end, so the walls are called the sarcolemma. So the walls of one small muscle is going to be called the sarcolemma. Is clear? Now we have dots here, dark dots here, which is just like the Z lines, but they are not going to be called the Z lines. Here they are instead called the dense plaque located at the sarcoplasm, the dense plaque. Now inside, just like the M line, we have something where the myosin filament is going to attach. Here is going to call the dense body. So on the dense plaque, we have the actin filament. On the dense body is the myosin filament. So these are also going to bind together, just like what we have seen before. So when we have calcium release, calcium are going to be released at the level of the caveolus, and those caveolus are the cuppings which are located at the level of the cell surface. So when calcium is released, it's going to stimulate down the production of ATP in the mitochondrion. So we have multiple mitochondria where ATP is going to be secreted, and when ATP is going to be secreted, it's going to cause down muscle contraction at the level of the dense plaque and the dense bodies, as you can see here. So we have further done everything now located involved with muscles. So you can just have a small brief summary as you can on this table, and then the pathological and histologic term by pausing this video. So say thanks for your kind attention. Don't forget to like and subscribe for the videos. Thank you.